This summit is unique because it brings together so many physicians who are interested in alternative and interventional ways of preventing ischemic stroke in patients with atrial fibrillation.
To fully disclose what we know about the subject of LAA occlusion, and the secret also is to try to share together the passion that we have for LAA occlusion.
I thought it was fantastic. I mean, we heard about many technical issues that we all deal with on our daily practice. I think it's an excellent meeting.
You see all the stakeholders in this patient neurologists who refer the patient, the interventional cardiologist.
In this area of cardiology, we need to collaborate with others because it's about stroke prevention.
So they can come together, they can discuss things, the less experienced can learn a lot from the very experienced.
The solutions that we have for everyday practice are not adequate, and we need to explore these other techniques. This meeting, more than any other, brings together, on the one hand, for example, the neurologists who see all the bad ischemic events and the bad bleeding events related to atrial fibrillation and anticoagulation, and the cardiologists who can provide some solution in the form of interventional techniques such as left atrial appendage occlusion.
Number one is the knowledge that comes together and the experience with the clinical cases. And second is the atmosphere. So it's very open discussions, no secrets, all that questions can be asked and answered.
We have so many new technical options to image the heart and to improve safety and quality of the procedure.
And I was really impressed of the new technology concerning, for example, just a combination of echo and fluoro.
In the future, we will have to use more imaging modalities to make sure of the procedure.
In 10-15 years, we will touch the hologram and somebody else is touching the true heart. So there is really everything is possible.
A perfect meeting. I love this meeting and I love to attend every year because I take home so many new information.
You know, having the two giants debating between whether we need to expand the guidelines for indications of LAA closure.
As therapy is going to develop with more implants across the sites, there should be significant more patients to run into those studies.
Much more and more data and much more questions that are being raised.
A lot of attendees learn from these, real life interactions between the experts on the panel.
And so this is why it is important to meet. And instead of just reading papers, it's important to meet and interact.
Yes, I'm very happy with the summit. It's now a big meeting. I think everyone wants to come. Each year we feel a lot of enthusiasm, and now I'm definitely happy.